Welcome to UMCC Medical Consultant Connectors, where your health matters us. Febrile seizures can be frightening for parents, especially when they happen to young children. These seizures are caused by a rapid increase in body temperature, often due to an underlying infection. While distressing to witness, febrile seizures are usually harmless and rarely cause lasting health problems. Febrile seizures are convulsions triggered by a sudden spike in body temperature, typically above 100.4 degrees Fahrenheit or 38 degrees Celsius. They most commonly occur in children between the ages of 6 months and 5 years. While any fever can potentially lead to a febrile seizure, certain infections like ear infections, roseola, and urinary tract infections are common culprits. It is important to note that febrile seizures are different from epilepsy. Epilepsy involves recurrent seizures due to abnormal brain activity. Febrile seizures, on the other hand, are provoked by fever and are not a sign of a chronic neurological condition. In most cases, children who experience a febrile seizure will never have another one. Febrile seizures occur due to the effect of fever on the brain. When a child develops a fever, their body's immune system releases chemicals to fight off the infection. These chemicals can sometimes affect the electrical activity in the brain, leading to a seizure. The exact mechanism by which fever triggers seizures is not fully understood. However, it is believed that the rapid rise in body temperature, rather than the fever itself, is a key factor. Genetics also play a role in febrile seizures. Children with a family history of febrile seizures are more likely to experience them themselves. Recognizing the signs of a febrile seizure is essential for parents and caregivers. One of the most common signs of a febrile seizure is a sudden loss of consciousness. The child may become unresponsive and their body may stiffen. They may also experience jerking movements of the arms and legs, which can be rhythmic or irregular. Other symptoms may include upward rolling of the eyes, loss of bladder or bowel control, and confusion or drowsiness after the seizure. It is important to note that not all children will experience all of these symptoms. Section 4. Diagnosis: determining febrile seizures. Diagnosing febrile seizures typically involves a combination of a physical exam, medical history, and sometimes additional tests. The doctor will begin by asking about the child's symptoms, including the duration and characteristics of the seizure, as well as any accompanying fever or illness. A physical examination will be conducted to assess the child's overall health and rule out other possible causes of the seizure. In some cases, the doctor may order additional tests to rule out other conditions, such as meningitis or encephalitis. Section 5. Treatment and care for febrile seizures. Treatment for febrile seizures primarily focuses on controlling the fever and ensuring the child's safety during the seizure. Most febrile seizures are brief and stop on their own without the need for medication. If the child has a fever, the doctor may recommend over-the-counter fever reducers, such as acetaminophen or ibuprofen. During a febrile seizure, it is crucial to keep the child safe and prevent injury. Gently lay the child on their side on a soft surface, such as the floor or a bed. Remove any objects from the area that could potentially harm the child. Section 6. Prevention and peace of mind. While not all febrile seizures are preventable, there are measures parents can take to reduce the risk and manage fever effectively. Ensure your child is up to date on their vaccinations, as this can help prevent common childhood illnesses that often lead to fever. Encourage frequent hand washing and good hygiene practices to reduce the spread of germs. At the first sign of fever, take steps to manage it promptly. Give the recommended dosage of acetaminophen or ibuprofen as directed by your doctor. Ensure your child stays well hydrated by offering them plenty of fluids. Section 7. Conclusion: supporting your child's health. Febrile seizures are a common childhood experience that, while alarming, are usually harmless and rarely cause lasting health problems. Understanding the causes, symptoms, diagnosis, treatment, and prevention strategies can empower parents to manage these events with confidence. Remember that most febrile seizures are brief, self-limiting, and do not require emergency medical attention. By staying informed and proactive, parents can help ensure their child's well-being and navigate the challenges of febrile seizures with knowledge and reassurance. UMCC, your ultimate medical consultant connectors.